Hey, it's Health Tidbits with Dr. Kohli. I'm Jenny D. And Dr. Kohli, of course, from 9 News. Her practice is called Cherry Creek Heart. And today we're going to discuss rucking. So I guess this is a new health trend, but what is rucking? You always have like these fun terms. I'm like, what is this?
I had Jordan Chavez on 9 News called it "What the Ruck."
What the ruck?
Yeah. So rucking is one of the latest health trends. My cousin actually told me about it, but now I'm having all these patients coming in and asking me. And essentially what it is resistance walking. So it's a cross between cardio and weight training. So you're basically doing some low-level cardio, which is walking, brisk walking, with weights on your back. And the idea here is you're burning, 30 to 50% more calories because you're carrying weights, and you're also having a lot of other health benefits as well because of those weights.
Yeah, and so, I mean, does it actually have the health benefits that they're saying it does?
I think so. It does. Because if you think about it, and where it came from was kind of military times. Remember, they used to walk with those backpacks. And even actually before that in Athens and all that, they used to carry sacks on their back as a way to train and condition themselves. Because what it does by adding more weight to your frame is it builds endurance. So cardiovascular tolerance is better. It gets your heart rate up higher. So like I said, it burns more calories, but also helps kind of just build your cardiovascular system. It's good for the blood vessels when you do that. It's good for the bones and the muscles because you're building muscle mass and you're building bone density. And it's a nice way to sort of not necessarily be high impact because for a lot of, especially as we get older, our joints and such can't handle the high impact cardio. So it's a nice way to turn up the volume on your muscle
and also
training.
If you're like, starting out too, this is a nice way to because you can kind of add weights as you go.
That's exactly right. Yeah.
And is there special equipment for it, or
so they do
just
have
put a bunch of books in a bag or what?
So they have things called rucksacks, which are expensive, $150 to $250, and special rucking vests. But the idea is you can do it at home with a backpack, books, and water bottles. But here's what I want you to be mindful of. Most of the weight should be on your hips. So you don't want it up here on your shoulders where it can cause chafing or it can cause tension on your neck or problems with slipping a disc or something like that. You really want it in the core, which is around the middle of the torso. So if you are going to just do it kind of the low-cost way, make sure the weight is balanced. Make sure that you're carrying most of that weight around your waist, so to speak. And then make sure you're not getting too much pressure on your shoulders. That could be causing chafing or shoulder pain or what have you.
I was going to say, because I have poor posture anyway. I've been working on it so much. Yeah. I feel like maybe if it is, it'll help you
stand up straighter.
Yeah.
Because it builds those core supporting muscles in the abdomen and in the back.
So who is it that shouldn't be using this sort of?
So most of my patients, I usually tell them not to, because if you have heart disease or lung disease or some other chronic medical problems, you might be higher risk from this. If you have any significant orthopedic issues, obviously like chronic neck pain, or you have any cervical stenosis or slip disc or even chronic shoulder pain or anything like that, you probably want to talk to your doctor before you use it. And I certainly wouldn't advise anyone who's pregnant to be carrying that extra weight as well without talking to their doctor.
Because we already carry it.
That's
and then you're going to carry it for life.
And you carry it around the waist. Yeah.
Pretty much.
My mom likes to joke that she's been in labor for 44 years.
Yeah. It is a labor of love, but it is definitely labor. All right. So Dr. Kohli, make sure you check her out. Cherry Creek Heart. She's on 9 News. And Rucking. What the Ruck. Thank you very much.